Hi, Dr. Balanoff here, and you know I love talking about dentistry and I love talking about how to make your dental practice grow. And what I want to talk about today is Botox. We know that it's a very popular thing and a lot of dentists are doing it, but a lot of dentists, they have a little bit of problem trying to implement Botox into their dental practice. So what I want to talk to you today about is how to get those patients to know that you do Botox. There's a lot of dentists out there that feel uncomfortable about sending out a flyer or some kind of email blast to their patient population announcing that they do Botox. So if we don't want to do that, then how do we tell our patients that we're actually doing it? It's a very interesting kind of trick I'm going to teach you. It turns out that a lot of our male patients want to get Botox done, but they don't want to go to a plastic surgeon or a cosmetic surgery office. Guys just don't like going there. So guys are really the #1 target for you to start doing Botox in your office. But how do we tell our male patients that we do Botox? So let's take a kind of a clinical situation. I have a patient in the chair and his name is Jeff and I'm doing a filling on him or a crown prep or something like that. And at the morning huddle we identify Jeff as the type of person that probably would want to have some Botox done. Over the age of 40, single, maybe wanting to look a little bit better, and that's the guy that we want to get to do Botox. So now I have my dental assistant Bethany there, and I go to Bethany and I say, hey Bethany, do you have the Botox prepared for our next patient? Whatever the patient's name is, let's go with the male patient. Do you have the Botox prepared for our patient Will? Now Jeff in the chair is going to be a little bit curious, and he may say, I didn't know that you guys did Botox. And it's like, of course we do Botox, Jeff. I mean, we just love doing Botox. And it turns out that most of the patients we do Botox on are our male patients. We have Will coming in at 11 o'clock, and Bethany's going to prepare the Botox. She takes it out of the freezer. We do a little, we make sure it's room temperature and all that other kind of stuff. It's a really simple thing to do. And here's the results that Will expects when we do Botox. He wants his face and his entire aura to look more rested. That's what Botox does. It gets rid of the crow's feet, it gets rid of these frown lines up on top over here, it gets rid of the little lines in the middle over here from you going like this. Botox is an amazing adjunct to making your face and your body just look rested. Now there's some other clinical manifestations for Botox as well. Botox can help with migraine headaches, and that's one of the FDA indications for it. But for the most part, let's be realistic, people do Botox because they want their face to look better without any wrinkles. So now we've just informed Jeff, who's lying in the chair, that we do Botox in a non-invasive, non-threatening way. And the simplest thing to do is, hey Jeff, are you interested in trying Botox? I think it would be great for you, and it'd be amazing what your face would look like afterwards. Jeff thinks about it for a while, and I can promise you 1 out of 2 times when you use that little approach to educating your patients about what you do in your office, Jeff and all patients like him will say yes. So what you want to do is identify those male patients in your morning huddle, spend a little bit of time talking to your dental assistant of how you're going to kind of talk over the patient about what you do for an upcoming patient, and you're going to find out that so many patients are going to say yes to Botox. It's going to become a really important thing in your dental practice. If you like what you see here, please subscribe to our YouTube page. We put out all different kinds of practice management tips all the time and really want your practice to grow. Thanks a lot.